Hello, I'm Hannah, and I'm going to be your nurse today. What's your name?
Matt,
And how old are you, Matt?
29.
All right, today you're in for a cardiac and peripheral vascular assessment. There's going to be a lot of looking, listening, feeling. It doesn't mean anything's wrong. We just want to do a thorough assessment. Do you have any questions before we begin?
No.
All right, first things first, we're going to just look at your arms. We're going to make sure that they're nice and symmetrical. Your skin is warm and dry, which is perfect. We're going to check your skin turgor. Make sure that you have some nice elasticity. Make sure you're not dehydrated. Squeeze my fingers. Perfect. All right, we're going to check your cap refill. Make sure that you're getting good blood flow to your extremities. All right, now I'm going to check your pulses, okay? Your radial and your brachial. And your hair is nice and evenly distributed. All right, now we're going to look at your neck. I'm looking for any lumps, bumps, bruising, or pulsations. And I don't see any, which is perfect. All right, now I'm going to palpate your carotid arteries just one at a time so we don't cut off any blood flow, okay? And on this side. Okay, Matt, now we're going to listen to your carotid artery, okay? I'm going to listen with the bell side of my stethoscope, and what I need you to do is take a deep breath, exhale, and hold it, okay? Are you ready? All right, deep breath in, exhale, hold it. All right, take a breath, and then we're going to do the next side. Are you ready? All right, deep breath, exhale, hold it. All right, perfect. All right, now we're going to move down to your heart. Okay, we're going to listen to your chest and a couple areas surrounding your heart just to make sure that we don't hear anything that's abnormal. All right, so go ahead and just sit up real straight for me. Perfect. And I'm going to listen with the diaphragm side first of my stethoscope. Okay, we're going to listen to your aortic, your pulmonic, your Erb's point, tricuspid, and mitral valve, or mitral. All right, now I'm going to flip around and listen with the bell side of my stethoscope. Aortic, pulmonic, Erb's point, tricuspid, and mitral. All right, Matt, now if you could just go ahead and lay down flat for me. Okay, first I'm going to look at your neck again. Just going to make sure that you don't have any pulsations, and we're going to check for jugular distension. So if you can look that way, perfect, and then look back at me, all the way back at me. Perfect. All right, you can look straight now. And now we're going to look at your precordium. Going to make sure that we don't see any pulsations or anything there. All right, now I'm going to just palpate those same areas I just listened to in your chest, the areas around your heart. You ready? Aortic, pulmonic, Erb's point, tricuspid, and mitral. All right, good deal. Now we're going to listen to those same points while you're lying down, just to make sure nothing has changed with your change in position, okay? Aortic, I'm going to listen with my diaphragm side first. Aortic, pulmonic, Erb's point, tricuspid, and mitral valve. All right, or mitral. All right, now I'm going to flip around and listen with the bell side, okay? Aortic, pulmonic, Erb's point, tricuspid, and mitral. Oh, all right. So now that we're at your mitral, I'm going to have you turn onto your left side. This is called a left lateral position. Move your arm out right here. And we're going to listen right here with that, to that mitral area. Perfect. All right, you can lay flat. All right, Matt, now I'm going to go down and look at your legs. I'm going to make sure that they're nice and symmetrical. Your hair is evenly distributed. I don't see any varicose veins. All right, I'm going to check for some edema here. You have none, which is perfect. All right, and now I'm going to palpate your pulses in your lower extremities, okay? So right here in your groin is your femoral, okay? And then we have your popliteal. And then we have your posterior tibia right here in your ankles. And your dorsalis pedis right here on top of your feet. All right. Perfect, Matt. That's all. Do you have any questions? All right, thank you. Today we did a cardiac and peripheral vascular assessment on a 29-year-old male. His upper and lower extremities were warm and dry, symmetrical with even hair distribution. His cap refill was less than 3 seconds. His grip was strong and equal. His skin turgor was elastic. There was no edema or varicose veins observed. All pulses in all extremities were equal and strong bilaterally. His carotid pulsations were equal bilaterally with no bruits. On inspection, there was no visible pulsations, heaves, or lifts. The apical pulse was palpable at the 5th intercostal space, left midclavicular line. His heart rate was 73 beats per minute, and it was a regular rhythm, S1 and S2 noted, no S3 or S4 noted.